Welcome, everyone, and thank you for joining us today. I'm Dr. Whitney Perkins Witt, President and CEO of the Health Equity Consulting Group. I'm a public health and equity researcher with 30 years of experience in advancing health equity through innovation and systems change. At the HEC Group, we help organizations design and implement equity-driven solutions using data and community insights and real-world strategies. I'm very passionate about turning evidence into action and accelerating meaningful and measurable impact in the communities and populations we serve. So today we're really excited to introduce you to the Health Equity Accelerator Toolkit. It's a very powerful, practical resource designed to support organizations in advancing health equity in meaningful and measurable ways. At its core, the toolkit provides a roadmap that's really grounded in evidence. It helps identify and address structural and systemic inequities and equips leaders with the tools, data, and actionable strategies to drive change. So with the resources from the toolkit, organizations can accelerate equity and make a more significant impact more efficiently and effectively. So whether you're beginning your equity journey or working to deepen initiatives or existing efforts, the toolkit is designed to help you operationalize equity, moving from intention to action and from action to sustainable, scalable impact in the populations you serve. So I want to first just step back and tell you a little bit about the HEC Group. These are our 4 pillars. We first begin with identifying inequities. We use data and research to look at the root causes of inequity in both health and social care systems. And the barriers are often invisible until we take a closer look through an equity-informed lens. Second, we collaborate with organizations on the ground. So healthcare providers, social service agencies, insurance companies, and CBOs. And these partnerships are vital because local leaders and service providers bring deep knowledge and the unique challenges that their communities face. And third, we don't just analyze problems, but we co-create and implement innovative solutions. These programs and policies are really tailored to each organization's needs and designed to directly address the root causes. And finally, we believe that what gets measured gets improved. So we developed a robust evaluation framework to assess the real-world impact of interventions. So I want to take a step back and just talk about what are inequities. So let's first define them. They're not just differences in health outcomes. They're unfair and avoidable differences that exist between different population groups due to systemic disadvantage or discrimination. Second, the causes of inequities are deeply rooted in the social determinants of health. Third, the impacts on the communities are really profound. We see higher rates of disease and disability and premature death, particularly in historically underserved and marginalized populations. And finally, to address inequities, we really have to implement multi-level strategies. So this includes really addressing the social risk factors for health outcomes. In this slide, this illustrates the evolution of the Institute of Medicine's healthcare aims over time, from the triple aim in 2007 to the current quintuple aim framework introduced in 2021. And I want to focus on that 5th aim, which is health equity. And this addition to the framework really acknowledges that we cannot achieve true and effective and sustainable healthcare improvement without addressing the structural and social drivers of inequities. So this really highlights and underscores the importance of measuring and evaluating health equity. So let's think of the toolkit as an accelerator. This slide provides really a high-level overview of the toolkit and the principles that we think about in developing the toolkit. First, we think about designing programs to move organizations from ideas to action. And the toolkit is really built to help organizations go beyond planning and dialogue and begin taking tangible steps towards equity. And it offers a structured roadmap rooted in all sorts of resources and data. We also believe in translating theory into practice, and equity can sometimes feel like an abstract field or abstract term. The toolkit really breaks this down, this theory, into specific and clear and equitable actions so that any team, regardless of size or sector, can begin implementing immediately. We also support measurable community-informed action, and this goal is real change. And that means putting communities and populations at the center and ensuring actions are grounded in their voices, experiences, and needs. We also take a comprehensive approach. Equity isn't a single initiative, it's really a systems level change or shift. And that's why the toolkit covers everything from foundations and assessment to program design, implementation, and evaluation. It considers governance, data practices, and partnerships all through an equity lens. So I want to talk about the 5Ws. So who is this for? It's really designed for leaders and teams in public health, health plans, providers, social service agencies, nonprofits, educational systems, foundations, and certainly the government, and really anyone seeking to embed equity into their services and systems. So what is it? It's a modular evidence-based resource that's packed with these practical and helpful tools like equity audits, strategic planning templates, stakeholder engagement surveys. We have training guides. We also give out evaluation frameworks to help drive equity. So when should it be used? At any stage of your equity journey, from readiness assessments and planning to full implementation and evaluation. It can be used for team training, strategic retreats, accreditation prep, or new initiative launches. So where can it be applied? Across your organization, whether it's in policy design, community program, or workforce development, or data systems, it's flexible enough to support not only departmental level work, but system-wide transformation. So why was it created? Because organizations need to move, do more than intention, and thinking about, the inequities. They need structure and support and strategy. So the toolkit was really developed to help teams turn equity commitments into sustainable and measurable change in an accelerated and expedited fashion. So this slide gives you a snapshot of what you can expect in the toolkit and how it's structured to support your work. First, the toolkit is built on a modular evidence base, and this means organizations can pick and choose components that meet their needs. So whether they're just starting out and looking to strengthen existing equity efforts, these tools guide users through the process of assessing, planning, and implementing and evaluating equity-centered programs and policies. Second, it includes a rich set of core components. And these range from equity readiness assessments to the social determinants of health and assessments to strategy and planning templates. We also include tools for engaging communities, shaping equitable policies, and tracking outcomes. So there's a strong emphasis on both process and accountability. And third, the toolkit is designed to support equity-centered initiatives. It's not just a planning tool, but it's a tool to drive change. So by using these resources, organizations can really move the needle towards health equity in the populations that they serve. Before we dive into the components of the toolkit, I want to first share the training and capacity building that you'll receive and the formats that the Accelerator Toolkit will come in. So the toolkit is built for training and capacity, and specifically through interactive e-learning modules, and these modules provide foundational and advanced training on really core topics like implicit bias, structural racism, and trauma-informed care. They're self-paced and designed to engage learners in meaningful reflection and really practical application. We also provide a facilitator's guide for people who want to lead in-person or virtual group learning sessions. And this guide includes structured agendas, discussion prompts, and facilitation tips. So it's really perfect for internal equity teams and community trainers. We also have a train the trainer curriculum, and this really helps build internal capacity by equipping staff to train other peers and other staff members. It includes customizable materials and a step-by-step guide for preparing facilitators to deliver equity-focused training confidently and consistently across departments. And finally, we also provide certificates of completion. They allow organizations to formally recognize participation in equity training, and that recognition can help build morale and promote accountability and signal organizational commitment to equity as a core competency. So this slide highlights the 4 flexible formats in which the Health Equity Accelerator Toolkit is available. And these formats are really designed to meet the diverse needs of organizations. So the first is editable templates and resources. And we're going to get into this in detail as we go through the components. The second is self-paced learning. So it's really ideal for learners who prefer flexibility or need to complete modules at their own pace. We also provide a branded binder or toolkit box for organizations conducting maybe in-person workshops, and it supports hands-on engagement and is a great way for teams to have learning sessions and trainings. And then finally, we provide cohort-based learning, and this building on self-paced learning. And this option allows users to participate in a structured learning experience through an online portal. It includes guided sessions and opportunities for peer engagement, regular content updates, and downloadable resources to support continuous learning in a collaborative setting. So people get to work alongside peers, and then they have the ability to connect with a qualified facilitator. So let's walk through the core components of the toolkit, which is designed to help organizations to move from awareness to action. So the first is the equity readiness assessment. And this toolkit begins with a survey. And it includes a comprehensive organizational audit with a scoring rubric, a leadership self-assessment, and stakeholder engagement surveys. These tools help organizations understand where they are on the equity journey, and it also includes a health equity maturity model that outlines the stages of progress from emerging to operationalized, so organizations can map their growth over time. The second component is health equity strategic planning. And for planning, the toolkit includes templates to build strategies, align vision and mission statements, and set goals. There's also a stakeholder alignment matrix to ensure cross-sector collaboration and accountability. The third component is community and population engagement and co-design. And this is to support authentic community engagement. The toolkit includes a culturally responsive outreach guide, templates to establish organizational advisory boards, and facilitation guide for participatory design. These tools are really there to help ensure that community voices are centered in program and policy development. The fourth component is program implementation and policy tools. This toolkit includes tools to support implementation, and development. And it includes an equity impact assessment for evaluating current and future policies, specifically operational checklists, service delivery, and sample policies on language, access, anti-discrimination, and trauma-informed care. An implementation playbook provides practical change management tips. The fifth component is metrics monitoring and evaluation. So measurement is really critical to track progress and to demonstrate impact. So the toolkit offers a menu of equity-focused metrics, logic model templates, sample evaluation plans, and an ROI calculator to help quantify the outcomes of equity interventions. And lastly, each of these components can be used independently or together as part of a comprehensive, scalable approach to advancing equity within the organization. So the first step in this process is really walking through the key stages of organizational goals, which is a foundational process for aligning strategy and measurable outcomes and driving performance. So we begin by developing a comprehensive strategy that directly supports the organization's mission. And we also set goals, so SMART goals: specific, measurable, achievable, relevant, and time-bound. And these are really essential for creating clarity, driving progress, and holding teams accountable. We're tracking goal performance. So with the goals in place, we're able to move to looking at performance. And this involves systemically monitoring our process, measuring results, and identifying areas that need attention or adjustment. And then providing feedback. As performance data comes in, we maintain regular communication. So this includes recognizing achievements and providing constructive feedback, which supports a culture of continuous improvement and motivates our team. And then managing goal performance. We use insights that we've gained to refine strategies and reallocate resources if needed and address any challenges. And this is really helpful to stay on course to ensure that organizational goals are effectively achieved. And this cycle is iterative and dynamic. So it enables organizations to stay agile while pursuing long-term success. So this slide highlights the four core tools included in the equity readiness assessment section. The first is the organizational equity audit tool. And this is a foundational assessment that helps organizations evaluate their internal structures, policies, and practices through an equity lens. And it includes a scoring rubric that identifies both strengths and areas for improvement, really to help guide where to prioritize. And then there's the equity leadership self-assessment. And really, equity efforts, as we know, must be championed by informed and reflective leaders. So what this tool does is it enables individual leaders to examine their own knowledge and behaviors and readiness to support equity within the organization. So it encourages personal accountability and leadership development. We also do a stakeholder engagement survey. The equity work, as you know, requires the input of those impacted by organizational decisions. So this sample survey is a way to gather feedback from staff and community members and other stakeholders to better understand perceptions and needs and priorities related to equity. And then finally, the health equity maturity model. So this model offers a structured framework to assess where an organization currently stands in the journey from emerging to operationalize. So it helps teams map their progress over time and provides a shared language to discuss stages of growth. So let's talk now about the strategic planning section of the toolkit. And this is designed to help organizations embed equity into every step of the strategic planning process, from setting direction to aligning stakeholders around shared goals. So the first resource is the equity-centered strategy template, the blue arrow. And this template offers a step-by-step guide for integrating equity into the organization's strategic plan. It prompts teams to examine how equity can be embedded into their processes. It's flexible and adaptable to a range of organization sizes and sectors. We also focus on SMART goals. So this is the light peach arrow here, and we've adapted the traditional SMART goals framework to ensure that goals are not only specific, measurable, achievable, relevant, and time-bound, but also aligned with equity. So this involves asking whether our goal helps reduce inequities and empower communities to promote inclusivity. The orange arrow here talks about our stakeholder alignment matrix, and this tool supports really identifying and engaging key stakeholders in a way that advances equity. It includes guidance for elevating underrepresented voices and ensuring community engagement in a meaningful and sustained way. And lastly, this red-orange arrow, we provide sample equity-focused vision and mission support. So we provide examples of mission statements to really help organizations clearly articulate their commitment to equity. And these samples can be served as inspirational and a foundation for organizations' own language that reflects their values and goals. The next component of the toolkit is really about organizations building trust and promoting shared ownership and centering community voices in the design and delivery of programs and policies. So here we provide a culturally responsive outreach guide, and this component really helps organizations with understanding best practices, and we provide templates and guidelines to ensure that outreach efforts are both culturally sensitive and inclusive. And it supports organizations in engaging historically marginalized communities with respect, awareness, and intention. We also offer community advisory board support. So the toolkit includes templates and guidance for forming these boards. And they're really critical for fostering meaningful partnerships and bringing diverse perspectives to the fore, and ensuring that equity efforts reflect the priorities and lived experiences of the community. We also have a participatory design facilitation guide, and this guide supports organizations in running design sessions where the community members are not just consulted, but actively involved in co-creating the programs and solutions. So it helps shift the power dynamic and elevates community expertise in shaping interventions. And then an equity-focused communication plan. This tool can help organizations plan come up with a plan that's transparent, inclusive, and aligned with community values. And we know that effective communication is a key element of equity work, so it really does help in building trust and supports accountability and ensures that communities are informed and empowered throughout the process. So this slide outlines the key steps in the planning interventions. It's not comprehensive, but it is really to illustrate that, that interventions are equity-driven, data-informed, and community-engaged. And each phase on this timeline is essential to ensuring that interventions are not only effective, but aligned with the needs of the populations experiencing inequities. So to start, we begin with recognizing that an intervention is needed to address an identified inequity, and this step sets up the foundation for intentional planning. So we dissect, the data and to understand the root causes, particularly the social determinants of health, to really look at trends and ask critical questions. And then we design targeted strategies. So once we understand these root causes, we can design strategies that directly address those drivers. And these interventions are tailored and they're culturally responsive and evidence-based. We also engage stakeholders for their input. So really no intervention plan is complete without meaningful input from those who are affected. So this step emphasizes the importance of engaging stakeholders, particularly community members, partners, and frontline staff. We also want to then allocate appropriate resources, funding, personnel, partnerships, and time to support implementation. Equity-informed interventions often require redistributing resources and to ensure that those with the greatest needs are prioritized. Now let's turn to the tools that can support effective implementation and policy alignment. This slide highlights 4 key resources that organizations can use to integrate equity into their interventions. So the first is the equity impact assessment. And this tool helps evaluate how proposed policy, program, and interventions may affect different population groups. We also have equity checklists. These are guides that support consistent application of equity principles during planning, implementation, and evaluation. They help teams stay aligned with equity goals and really flag areas that need attention. We also focus on equity policies and provide examples. So this is really helpful in centering equity and accelerating the policy development. These examples will offer templates and language that organizations can adapt to their own context. And then the implementation playbook. This is a step-by-step guide that outlines how to operationalize equity strategies. It includes timelines, roles, accountability measures, and metrics for success. And really together, these tools provide structured, actionable frameworks for turning equity commitments into measurable and sustained change. So this slide outlines a 6-step approach to effective program implementation. It's designed to ensure that programs are rolled out strategically and refined through feedback and sustained over time. So the first is the rollout of interventions in a phased approach. We begin with a phased rollout to reduce risk, manage resources, and learn as we go. So this allows better control and responsiveness as the program unfolds. We also start with a pilot program. So before full implementation, we test the strategies on a smaller scale, and pilots help us evaluate what's working and what needs improvement without committing full resources too early. We also gather feedback from stakeholders and community members. As we've talked about, that's really essential in gathering meaningful insights that could shape the program's evolution. We also want to optimize the program based on the feedback that we receive and what we learn. So using the information we collect, we then refine strategies to make the program more effective and responsive to real-world needs. We maintain the program with ongoing monitoring and adjustments. Implementation isn't just a one-time event. We need to continuously monitor progress and evaluate outcomes and make sure necessary adjustments are made to ensure continued relevance and impact. And then finally, we want to make sure that infrastructure, staffing, funding, training, and tools are in place to support successful implementation and long-term sustainability. And this structured approach helps increase the chances of program success and ensures that we remain aligned with community needs and organizational goals. This slide provides a visual overview of the 4 key phases of program implementation. Each phase is distinct but interconnected, contributing to really a successful, sustainable program. So the first is the pilot stage, and we begin with a small scale pilot. It allows us to test our assumptions and identify the roadblocks early and refine before we roll out. And then the rollout phase. Once the pilot demonstrates effectiveness, we expand implementation. This is the broader deployment of the program, often in stages, depending on the study design, to manage scale and ensure consistency. So we use lessons from the pilot to guide this process. And then the optimization phase. As the program scales, we want to shift our focus to optimization. We collect data, we monitor the outcomes, and we gather feedback from participants and stakeholders. And this phase is about continuous improvement and refining our approach to enhance effectiveness and really also efficiency. And then finally, the maintenance phase. And this is where we, at this stage, we have equity embedded into the operations. We ensure that long-term sustainability through ongoing support, performance tracking, and periodic reviews are kept in the program and aligned with evolving needs. And this phased approach helps manage complexity, and it reduces risk, and it builds mechanisms for learning and adaptation throughout the implementation process. So this slide highlights the 4 essential practices for effectively monitoring progress throughout the program implementation. So think of this as a feedback loop that ensures that we're staying on track and making evidence-based decisions. At the center is the outcome tracking. We use tools like scorecards to measure impact and assess whether our goals are being met. These data give us a clear picture of what's working and where the gaps are. We engage the community, as we've discussed. It's really about integrating their voices and amplifying their voices in this process. We also adjust strategies. So we use, with both data and feedback in hand, we can make these timely adjustments. And this is really critical for staying agile and refining our approach in real time. And then finally, maintaining transparency. We prioritize this because we want an open reporting process, and we want to build trust with our partners, funders, and communities. It reinforces accountability and creates shared ownership of outcomes. And these 4 practices really work together to create a strong foundation for continuous improvement and long-term success. So this slide outlines the first essential step in building an evidence-based approach to advancing equity, where we collect and analyze meaningful data. So we want to identify relevant tools and metrics. So we begin by selecting the right tools and indicators to measure inequities. And this may include demographic data, achievement gaps, access to healthcare or other resources, social determinants of health, and level of representation across programs and services. And this is important that the tools we use are sensitive to the context and allow us to uncover structural barriers or disparities. And once we've identified our metrics, we use them to gather data and set baseline benchmarks. These benchmarks really help us understand the current state of equity and inclusion within an organization or community. And they serve as our reference point for tracking progress and guiding future decisions. This process really lays the groundwork for evidence-based planning and allows us to monitor change over time and make informed decisions about our strategies. Without accurate baseline data, it's really impossible to know where we started or how far we've come. So once a program is in motion, we need a rigorous way to show that it's making a meaningful, measurable difference. This slide highlights the 4 measurement tools built into the Accelerator Toolkit, each designed to give teams clear, actionable insight while really underscoring the equity focus. So the first is equity-focused metrics. We first provide ready-made menu of indicators covering access, utilization, quality of care, health outcomes, social determinants of health. And each metric is disaggregated so that organizations can spot disparities by race or zip code, language, or payer mix. And by starting with standard metrics, we can ensure that everyone is speaking the same language from day one. The next resource here is logic model templates. So these are customizable templates that teams can map the full causal chain from beginning to end. So from inputs and outputs and long-term outcomes. And these templates create a shared blueprint that aligns staff, partners, and funders around what success should look like and how we should measure it. So we also include full evaluation plan samples covering both process and outcome measures. Process measures are very important in ensuring that the fidelity of the intervention is in place. They shorten the startup time for new initiatives, offer best practice language for IRB or grant submissions, and ensure that no critical data element is overlooked. We also focus on return on investment. So we have a calculator that looks at impact and turns impact into dollars and cents. So it quantifies both economic and social returns, helping leaders justify equity investments in terms of populations that are readily available to understand and need this information. So like CFOs and boards, this would be important information to share. In addition to the core components, I wanted to underscore that we meet organizations where they are to customize and scale their equity work based on their unique needs and infrastructure. So we do tailor the toolkit materials with your organization's branding, including logos, color schemes, and language preferences. And this ensures the toolkit feels fully integrated into your internal system and identity. Virtual assistance. Technical assistance. This includes 3 hours of personalized coaching or consultation with our equity experts. Organizations can use this time for implementation support, strategic advice, or staff training, depending on their priorities. And then we also, for organizations pursuing health equity certifications, like the HEC's own Health Equity Scorecard, we provide a readiness checklist aligned with standards. And this really helps teams assess where they stand and what gaps are needed to address before submission. We also do some integration of data. So this option supports the integration of toolkit data and templates into existing electronic health record information or population health systems. It ensures that equity tracking becomes part of the routine workflows and making data collection and reporting more efficient. So as we close today, I want to return to the heart of this work, which is really building equity-centered programs that truly make a difference in people's lives. And the Accelerator Toolkit really provides information, but also actionable tools to help organizations assess where they are, really chart a course forward, and implement meaningful and measurable change. So whether your organization is launching a new initiative or deepening an existing effort or preparing for accreditation, this toolkit is really designed to be flexible and practical and grounded in evidence. So by using this resource, organizations can move values to action and from good intentions to sustained impact. It's really about embedding equity into the daily rhythm of decision-making and how we deliver services and how we engage with communities. So thank you for your time and interest. I hope you leave today inspired and equipped with ideas of how the toolkit can support your mission and advance equity in the communities you serve. Just one final thing. I did want to mention is that we would really love your feedback. So please take a moment to complete our survey. Your input really helps us in improving the Accelerator Toolkit to better meet your needs. So you can provide feedback in the link in the chat. And I want to thank you for participating today, and we'll open it up for questions.